Welcome back. Again, this is Medicare Joe, and in today's video, we're going to be talking about the two main exposures that a Medicare Advantage plan has and why we always recommend adding the riders to help cover those exposures. Now, if you have your appointment coming up with one of our agents and that's why you're watching this video, or maybe you found us on YouTube, it's important to watch this video in its entirety because I'm going to be discussing in detail the two main exposures that an Advantage plan has, and these exposures could end up costing you thousands of dollars in medical bills. Now, if you want to be updated as we post new Medicare content and new videos to YouTube, click the red subscribe button here below, and that will notify you whenever we post a new YouTube video. So without further ado, let's dive into the actual content for today. And again, this is the number one concern that I feel Medicare Advantage plans have is these exposures. So let's talk about it. So let's dive into the actual content for today. And from what I find in my experience, the number one concern for people that are picking a Medicare Advantage plan to be their insurance is they're looking for the lowest possible monthly premium cost in comparison to choosing a Medicare supplement, which can cost upwards of $120 a month. More in the link in the comments below discussing Medicare Advantage versus Medicare Supplement. We're going to keep this video specific to just Medicare Advantage. But ultimately, the priority for people picking a Medicare Advantage plan is to try to keep their monthly premium as low as possible. And there's a lot of benefits that come along with the Medicare Advantage plan. A lot of extra add-ons, dental, vision, hearing, silver sneaker gym memberships, and so forth. There's a lot of extra benefits that are built into a Medicare Advantage plan. And the main way a Medicare Advantage plan works, not to mention any carriers and due to compliance, this is just an example. These are going to be some of the copays that you'll see on a Medicare Advantage plan. So your primary care doctor is going to be free. If you go to the specialist, you're looking at a $30 copay. If you're in the emergency room, $90 copay. Physical therapy, $20 copay. Now, these copays are not terrible. They're certainly doable, and most people don't have any problem paying these copays. But the two biggest expenses that come along with the Medicare Advantage plan that most people do have an issue with is number one, the hospital copay, and number two, cancer treatment. So first I'm going to go over the hospital stay and kind of show you how that works on an Advantage plan. And ultimately, with the summary of benefits that an Advantage plan comes with, you'll see that there's usually a $300 to $400 per day copay for the first 5 nights of a stay. So ultimately, if you're in there for 5 nights, you could be paying $300 per day for those 5 nights. So here's an example here on this plan. It's $325 copay for the first 4 days of a stay. On this one, I'll change over here. This one is $295 a day for the first 6 days of a stay. Again, not mentioning any carriers due to compliance. And here's one more, same type of copay, $295 a day for the first 6 days of a stay. So those are 3 different carrier summary of benefits that have this same type of style for the hospital stay copay. Now, if you're looking at this, 1 night in the hospital is probably doable for a lot of folks to pay that copay. But if you have a multiple night stay, this is where this cost can really add up. I mean, if you just look at it for a 3-night stay, you're at $1,000 cost for that hospital stay. And it's always, mind-boggling to me for folks that choose the Medicare Advantage route because they can't afford the extra $120 for a supplement, which I completely understand. But if you think about it logically, if you can't afford the extra $120 a month premium that a supplement would come with, chances are we're not going to be able to afford a $1,000 hospital bill either. So the question becomes, well, what's the solution? And this is why I always recommend adding the hospital indemnity plan, aka a hospital rider. Ultimately, how this hospital rider will work is it's going to pay every night that you're hospitalized. So let's go over a quick example here. Let's say that you're hospitalized for a 5-day stay and the cost is $300 per day. The rider is going to mirror that cost. So the way that it'll work, it's going to pay you $300 a day for the first 5 days of a stay. And this doesn't matter however many times you're hospitalized, it works the same way. So if you're hospitalized, admitted once, and then you're discharged and you get hospitalized a few months later, it's going to pay every time you're hospitalized. So what this does is it makes your actual out-of-pocket cost for that 5-night stay zero. There'd be no cost. It'd be completely covered. So again, you have your $300 per day plan cost, but the rider is paying you $300 a day. So you come out paying nothing for that stay. Now, again, I'm very passionate about this hospital rider because not only does it provide a great value to people, but it comes at a very low cost to add to your plan. And I'm going to touch on that in a little bit here. But first, I want to touch on the other concern that folks have, and that is when it comes to cancer. Now, in my world working with Medicare, cancer is very relevant. 1 in 2 men over the age of 60 are being diagnosed. 1 in 3 women over the age of 60 are being diagnosed. And on any Medicare Advantage plan, there is what's called a 20% coinsurance for chemotherapy. Now, I'm sure you probably are aware of what a copay is. It's a flat fee that you pay for a service. But what a coinsurance is you're actually going to be paying a percentage of the bill. And the common coinsurance for chemotherapy is 20%. And here's a couple of examples showing you that. Here's one carrier that has a 20% coinsurance for chemotherapy. Here's a completely different carrier, same thing, 20% coinsurance for chemo. So you can see this, and this is on every Advantage plan. If you just pulled up any summary of benefits that's not, Medicaid or anything like that, you're going to see this 20% coinsurance there. And not also, to also mention, that's the medical cost, but there's a lot of non-medical costs associated with cancer too, like transportation, home care, lodging, and so forth. So. But let's just focus on, for this video today, the 20% coinsurance that can occur when you go through chemotherapy. The way that this is going to work is because you're paying 20% of the bill, and let's just say chemo is tens of thousands of dollars. We know that it can range from $10,000 up to $200,000. You can almost guarantee, if you're paying 20% of the bill, that you're going to hit your out-of-pocket maximum. And what the out-of-pocket maximum on a plan is if you take your co-pays, any deductibles, co-insurance, pretty much any type of medical cost that the plan's making you pay, and you take all that and you hit your out-of-pocket maximum, at that point, you would no longer pay any more co-pays or co-insurances for the rest of that calendar year. So here's some examples of what the out-of-pocket maximum is with these plans. Again, it's usually $5,000 to $7,000 a year. Here's one that's $5,400. Here's another one here that's $6,700. Here's another one that's $6,700 as well. So once you hit these out-of-pocket maximums, at that point, the company is going to be covering everything for the rest of the calendar year. So the one way that I've seen people hit these out-of-pocket limits is with chemotherapy. Again, the cost of chemo being tens of thousands of dollars, if you take 20% of that, it's easily going to hit that out-of-pocket threshold. So let's use an example too here now. This is another scenario that I unfortunately had to witness. We had somebody that started treatment in September of, let's just say, 1 year, okay? And they hit that $5,400 out-of-pocket limit that year. Now, for them, come January when the new year reset, they were still going through treatment and they had to hit the $5,400 out-of-pocket limit again. So now what happens is this person, in less than a 6-month window, has more than $10,000 in medical bills that they had to pay because of this chemotherapy. And for me, I'm extremely passionate about people understanding this, because it's way easier for someone to be proactive with their insurance and understand how it works instead of being reactive to the situation and when the medical bills finally start to come in. Now, like the hospital rider works, to cover the cost of a hospital stay, there is also a cancer rider that will cover the cost of if you're diagnosed with cancer. And ultimately, it's called a lump sum cancer plan. What does that mean? Well, basically, you get to pick the benefit level that you want, but they have a $10,000, $20,000, $30,000 benefit, which they will cut you a check for that amount if you're diagnosed with cancer. And then you can then use those funds however you wish, but ultimately the need for it would be for the cost that you're incurring on your Medicare Advantage plan. So again, there's a $10,000, $20,000 is probably the most popular, and then there's a $30,000 benefit as well for folks that are more concerned with not only the medical expenses, but also potentially a lot of non-medical expenses. And again, you probably have noticed this by now, but the reason why I'm so passionate about these two riders and how they work is because of the cost. With these two riders, you can add these to any Advantage plan for as low as $50 a month. Regardless of, if you're diagnosed with cancer later on down the road, if you just have a 2-night hospital stay, the riders just paid for themselves at that point. If you do get diagnosed with cancer, knock on wood, it never happens, but you'd be way ahead of the game at that point based on what you're paying in premium. So how we show this to our clients and how we more or less look at this is, you have your bare bones option for Medicare Advantage, but we just call this the core product. Medicare Advantage is $174.70 a month. You'd have your hospital cost, let's just say it's a $300 per day copay, and you'd have your out-of-pocket limit of $5,400 for the year. And you can keep your coverage just like that if you're comfortable with how that looks. But here in our office, how we tier our plans is we tier them based off of a bronze, silver, and gold style. And this is nothing that is related to Medicare. This is just here in our office, how we reference these plans and how they're packaged together. So the bronze plan and how that looks is you'd have, if you chose the bronze plan, your cost, inclusive of your Medicare premium, would be about $225 a month. And the way that this would work is it's going to completely cover that $300 copay for the hospital stay. And it will have a $10,000 benefit cancer rider to cover the cost of that out-of-pocket maximum for any type of cancer treatments. Now, the silver plan, again, this is the most popular one that people have been picking. This is going to be about $250 per month. Instead of the $174.70, it'd be about $250 per month. And you'd have the hospital rider completely covered there. And you'd have a $20,000 cancer rider to cover that out-of-pocket maximum for multiple years. Or the highest level of coverage, which we classify as the gold plan, that would be about $275 a month. And again, the way that this would work is it's going to cover that hospital rider. And then you'd have a $30,000 cancer rider, which not only will help for mainly the medical costs on the plan, but it's also going to give you enough funds to help cover the non-medical expenses that also are incurred, like transportation, lodging, home care, loss of income if a spouse is still working, and so forth. But either one of these three options here, what you're doing is you're eliminating the two main concerns that any Medicare Advantage plan has just by paying a little bit more in premium than what the bare bones coverage premium is. And paying that little more in premium can help cover the unknowns of what can come up while you're on the plan. Now, one thing that a lot of our clients will ask, and this is why I'm addressing it now in the video, is they tell us, well, I'm healthy now. I'm not anticipating a hospital stay in the next year or cancer in the next year. Can I add this on at a later date or in a couple of years? So there is a kicker. There is always a kicker when it comes to insurance, right? But the kicker in this sense is that the insurance carriers that write the riders, they guarantee issue you into the plan when you're turning 65. So what that means is there's no medical underwriting that you need to incur when you're turning 65. They automatically will approve you for these plans. Now, if you wanted to wait to add these at 67 or 70 or whenever, at that point after you've turned 65, you're going to now have to answer medical questions to be able to be approved for these riders. And at that point, you may not be able to add them on if you can't be approved. So it's extremely important that if you have any type of interest or like the idea of how these riders work, to add them on when you're aging into Medicare. So that way you're guarantee issued into the plan and there can't be any way that they can turn you down. So again, if you're watching this video and you have your appointment coming up with one of our agents, make sure to mention which tier plan you're most thinking of, the bronze, silver, or gold. And that way your agent can give you specific pricing to that plan. The costs are a little bit different based on your area and at what age you do come to us. So that way they can help you budget out what you're most comfortable spending on your healthcare on a monthly basis. And if you stumbled upon us here on YouTube and you want to add these or talk about how these work or get exact pricing on the riders, I just put our number here up on the screen. You're welcome to give us a call. Our agents here are happy to help, but you can also book a call by clicking the link in the description below and getting on our calendar with one of our agents. Lastly here, I hope you enjoyed this video. I make these for you, so please hit that like button if you did. The way that YouTube works is the more likes a video has, the more people it's going to put it in front of, and that way it can get our message out to more people as well. And again, if you'd like to be notified when we post any new YouTube content, new YouTube videos, click the red subscribe button below. And what that'll do is that'll notify you whenever we post a new video to YouTube. So that completes our top exposures on a Medicare Advantage plan video. Our team again here is happy to help you moving forward with any questions you might have. Thank you for watching today and take care.